Well, this graphic is showing where quite a few of us are at the moment, and of course it's adjusted per capita. So Canada, Germany, the United Kingdom, a flattening off and a definite downturn in the United Kingdom, as we're seeing by that graph. Italy, a flattening in Italy. Italy did well and then it increased dramatically. Unfortunately, the line for the United States here, adjusted per capita, doesn't show a levelling off yet. So we do see this sharp increase in per capita cases in the United States. So these are all very comparable comparisons to make. And just to show what can be done, France and Belgium here, we see the numbers going down quite dramatically. There's other countries we could have put on here, Netherlands for example, also showing a significant reduction. So welcome to this video, of course. What are we going to do today? Let me think. A bit of update from the United States, looking at ventilation and looking at the state of the Oxford vaccine as well, and a bit of general news. But some interesting principles as well coming out of the States, and we're going to look at the multisystem inflammatory syndrome in children as well. So let's just look at the graph for the United States there to begin with, actually. And we're seeing a bit of a north-south divide, aren't we? So this is last 7 days new cases. Northern states, unfortunately, really quite dark blue. Southern states, slightly less by comparison. Obviously, I always post the link for this, so go in and look at it. And they're the states with the greatest increases in the last 7 days per 100,000 of the population. And we see the Dakotas near the top of the list, as we have considered. Now, the other thing I've been following is been following this quite a bit. This is the RT value, the increase in cases for various states. And I wondered why Mississippi seemed to be doing so much better than the other states. So I had a look at it, and basically it looks like these graphics are wrong when I actually looked at it. So I probably won't be using this RT comparison site again. Let me tell you why. Let me tell you what's going on. So anyway, the United States in general to begin with. 328 million people we know. Now this is the cases yesterday, that's the new cases the day before. These are much higher numbers than we have been seeing. And the deaths so far in the United States are 250,000. Now this is the official CDC figure. Other sites are showing that the 250,000 milestone really has been exceeded, and that's 0.076, under 0.1% of the American population have died. Now I just put that in because I think it's just important to keep this in context of the population, because it's easy to look at the United States and everything looks terrible, but then when we do look at it per capita, as we've just done, it makes it more contextualized, I really feel. Now, just looking at that example of Mississippi, that site here is saying that the RT is 0.9, but when you look on the CDC site, it says there's been 1,395 cases yesterday. That's the total number of cases. And it's also saying the cases are up 53% in the past 14 days. So it is kind of hard to see that these are compatible. Maybe this is just a bit out of date. Deaths in Mississippi, another 18 deaths yesterday. And again, deaths are up 11% in the past 14 days. So cases up 53% in the past 14 days. Sorry, cases up 53% in the past 14 days. Deaths up 11% in the past 14 days. And of course, this is unfortunately the classic picture that we get when we see increases. First the cases goes up, and then the deaths go up after. So unfortunately, we are going to see deaths carry on increasing in Mississippi, almost inevitably. Well, it is inevitable really, it's baked in, because it's based on the number of these cases that are going to become severe. So this feeds through. And actually we can see this in the middle. I should have maybe put this figure in the middle, the hospitalizations, up 24%. So what we see is the cases going up first. That's what happens first. Then we see the hospitalizations going up second, up to 24% in the past 14 days. And then sadly we see the deaths go up third. So that's kind of the sequence of events and the delay. So from this increase in cases in Mississippi, for example, but we could have taken anywhere really, the cases have gone up first, then the hospitalizations will also go up, and tragically the deaths will go up as well. That's kind of inevitably what happens. So we do see that Mississippi is increasing, as are the other states at the moment. To look at the states overall, go on to here. That's the graphic. These are always in the description. Just go on, click on them. They're the links I use. Trends in the states. Again, you can look at the trends, which are clearly increasing. Hospitalizations are also increasing in the states, although this particular data set does have quite a significant delay on it. Really quite a significant delay, actually. About 3 weeks old, the data on there, because it always shows that hospitalizations are going down in the latest data, but we know for a fact they're not. So quite a big delay in official hospital data actually from the states. Now, we've talked often on this video about culture and the spread of disease. So we talked about people going to Islamic shrines and interacting and kissing the shrine and things in Iran. We've looked at Christians meeting or hoping to meet over Easter, and very often weren't allowed to. We have Christmas coming up, of course. Very often in this pandemic it's been necessary to suspend some cultural events. And of course, when Thursday the 26th of November is Thanksgiving in the United States. Great to remember give thanks for the first harvest, of course. But people in England don't understand how significant this is. People in the UK, Europe don't understand how significant this is in the United States. So I just want to let you know really that many of us here in Europe do empathise with the sacrifice that you are making for this in the United States, and you are going to have to make a sacrifice, I'm afraid, because the opportunity for family mixing and super spreading events there is really quite big. So it's one of those cultural things that really need to be suspended, and if it helps at all, I know how significant that is in American culture, but it's going to be really just a potential super spreading event this year. Now the Centre for Disease Control are onto this, so that they've actually instigated a complete site there for advice on Thanksgiving preparations, and they do say this. Might be a bit small print. More than 1 million COVID cases were reported in the United States over the last 7 days. That is updated today. As cases continue to increase rapidly across the United States, the safest way to celebrate Thanksgiving is to celebrate at home with people you live with in individual households. So that is the CDC advice on Thanksgiving, and click on that link for the full details. Nothing you really wouldn't expect to be there. Actually, it's pretty well common sense. Now, I don't want to be alarmist. I've said that the death rate in the United States is well under 0.1%, and it is. But I put this in not to be alarmist, but to have an index of suspicion. If children get sick a week or 2 to 4 weeks after they've had COVID-19, then do consider the possibility that they could be developing something more serious, and get a medical opinion at a very early stage is the key message I want to get across here. So multisystem inflammatory syndrome in children is occurring. Now in the whole of the United States there hasn't been a lot, 1,163, but without care many more of these could have died. And this is the key message in children. We tend to think that children get mild disease. Thankfully they do. Tend to think children will be fine. Thankfully nearly always they are, but you get the odd case that isn't. Now this multi-system inflammatory syndrome cropped up just a few months ago, and it seems strange that it was popping up during a pandemic, but it wasn't clear that it was caused by the pandemic. But we now know from United States data that 98% of the children that test positive, that develop this multisystem inflammatory syndrome, have tested positive. either for an antigen or an antibody test. And the 2% that haven't have had a documented history with COVID-19. So I think it's fairly safe to say from this information that it's massively likely that this multisystem inflammatory syndrome is a complication of COVID-19. I don't think anyone said it's proved yet, but it's essentially proved. Most cases develop 2 to 4 week delay. So if children are a bit poorly, 2 to 4 weeks after a suspected infection, take medical advice early. Boys slightly more affected than girls, but nothing really significant there, I wouldn't have thought. Slightly more. 1 to 14 years of age most common, although older teenagers have been reported as suffering from this. The average is 8 years of age. And we see Hispanics or Latinos and black people, non-Hispanic black people are greatly overrepresented. So if we add those two together, we're looking at over 800, and that's the total number of cases. So greatly overrepresented in terms of population size or population makeup. So do have this, I don't want to worry people, but do have this index of suspicion for this time period, 2 to 4 week delay after the initial illness is when this syndrome develops, if it's going to, and it's very unlikely it will, but early medical advice is essential. There has been 20 deaths in the United States from this. So we haven't mentioned that for a good 6 weeks or so now, so I just felt that was appropriate to bring that up there. Now, good news story from the States now. The bottom line is that there was a situation where there was a gym owner, and one of the people that went to the gym was some sort of environmental engineer, and they worked out a really good way to ventilate the gym. And that was proved, or evidence was given that worked when one of the gym instructors went into work one day, then the next day they were diagnosed positive, but they'd been in relatively close contact with 50 other people. So the gym owner contacted these 50 other people, and not one of them presented with symptoms. Quite a few of them went for testing, and they all tested negative. So it just shows how important ventilation is. So just a very quick run through this, because it's such a useful example, I think. We've been talking about this for some time. Hands, face, space, of course, and ventilate is the one that people are still not doing well. This one was in Virginia. It was a civil and environmental engineer who went to the gym. She instigated 10 feet spacing, whereas only 6 feet is recommended. So that's 2.5 meters. Because the ventilation is the key thing. More airflow than recommended. She instigated more airflow than recommended by the American Society of Heating, Refrigeration and Air Conditioning Engineers. So indicating that the official recommendations for ventilation in the United States may be enough or may not be enough. We don't know, because they instigated more airflow than is officially recommended. And the engineer said, we don't see outbreaks above a certain threshold of ventilation. That's increased ventilation. We don't see outbreaks. And the gym with the open doors was always way above that. So they were always better ventilated than the guidelines. Now, what they were doing here, and this is a really good idea, carbon dioxide monitor to track indoor levels. Now, this is a really good idea, because the idea here is that if you're in an indoor environment and the carbon dioxide levels are building up, if you're in a shared indoor environment, the carbon dioxide levels are building up. That means the exhaled air levels are building up. And of course, it's in the exhaled air in infected people that we get the water droplets and the aerosolization. So it's reasonable to assume if there's more carbon dioxide in the area, the amount of aerosolized exhaled droplets, potentially containing the virus, are also increasing. So titrating ventilation with carbon dioxide levels is actually a really good idea, and that's the first time I'd heard that idea. So I think that's a great idea. So I don't know what the levels are, unfortunately. I don't think anyone does. But presumably, if carbon dioxide levels were getting up to 800-900 parts per million, then it might be time to increase the ventilation, because you could assume from that there was more water droplets in the air, because the carbon dioxide and the water droplets are both exhaled in exhaled air. So I thought that was a really interesting idea, carbon dioxide monitors. Maybe people will take that up more. Great idea to titrate ventilation. So they had tape on the floor and masks, no wandering around the gym, no partner workouts, no hugs, no kisses, and ventilation redesign. And the gym trainer exposed 50 people, and none of them got sick. Some of them went for tests and they all tested negative. And the gym owner did follow them up for 2 weeks. So I think we can say basically that a cluster there was avoided by good ventilation. And many places I go into now, I still get the impression that the ventilation's rubbish. So there you go, that's one thing we need to think about. The other thing to think about, if you work in an office, talk to your office manager and make sure that they're getting enough, that they're not recycling the heated air, that it's being, that lots of 100% fresh air is coming in rather than recycling the air, as they did, we believe, on the Diamond Princess, where the disease did seem to spread from cabin to cabin. So that's an interesting point to bear in mind. Now, Oxford vaccine, bit of an update on the Oxford vaccine. Now, yesterday there was a publication in the, where have I gone? There was a publication in the Lancet on this, full peer-reviewed publication of the stage 2, the phase 2 clinical trials. And basically it worked, and it appeared to be, it worked and it appeared to be safe. So looking really, really good for the Oxford vaccine. And of course, after the Pfizer and the Moderna vaccine, this is interesting because the Oxford vaccine, of course, is a different type. It works in a different way. So is this going to produce immunity that's equally good? Of course, is a fascinating question. Is it that we can generate a good vaccine-induced immune response to COVID-19, SARS coronavirus 2 intrinsically, or was there something particularly brilliant about the 2 messenger RNA vaccines that's first come out? We don't know that yet, and it's frustratingly slow, I must say. Good thing about the Oxford vaccine, easy to store, costs £3 per dose, dirt cheap, and it's the way out for the UK and much of Europe, with 100 million doses on order for the UK alone. Late stage clinical trials going on in the UK, US, Brazil, South Africa, Japan and Russia. 50,000 participants. When the heck are we going to know? This vaccine is just going to be, it's going to be the main lifeline for the UK and much of Europe. When are we going to know? Well, phase 2, all very good. Phase 3 we have to have, of course, with the 50,000 participants. Absolutely delighted with the results, the professor in charge. We're seeing the immune response look exactly the same even in those who are over 70 years of age. This is stunning. Older people are generating an immune response, and this was the case with the Pfizer and the Moderna vaccine as well. So this is just remarkably encouraging that older people are generating an immune response, which is unusual with many vaccines. Level of efficacy, well, we know there's neutralising antibodies, which is good. We know there's T cells. Does it work in the real world? We simply don't know yet. The professor says we are not there yet. We haven't got the numbers. The data release will be before Christmas, but that is a few weeks away yet, so frustratingly slow. The professor did say they're not in competition with other vaccines, but of course they actually are. Multiple vaccines needed. We will need all of them to protect people around the globe. So agree with all of that. The more vaccines we have, the better. It looks like this vaccine is going to work. It looks like it's safe, but we don't have that data yet. And of course, we'll have to wait for 2 months after the last dose has been given. So really, I don't think we're talking about this vaccine being available realistically till February. So frustratingly slow. Part of the problem was a couple of people got ill and they had to suspend the trial a couple of times, but it turns out that the illnesses that they reported did not seem to be caused by the vaccine. So it is looking safe. Moving on to Russia. Now obviously there's many fewer cases in Russia than in other comparable Western countries. Fewer cases, but because it's a large population, United States, India, Brazil, France, then Russia is the order. Fewer deaths than in other Western countries, although Moscow is the the worst affected area. So good to know that cases are much lower in Russia and deaths are much lower in Russia than in other westernized countries of similar population levels. Good to know that, isn't it? Good to know the official data from Russia is looking really good compared to other countries. Good to know that. Right. World Health Organization's chirped in again, basically saying the obvious. Dr. Tedros bemuses me that there's been no change of staff in the higher levels of the World Health Organization. I expect it bemuses you as well, but there we go, there hasn't. Surges in cases in Europe and America, thank you for that. Countries that, I mean, you can't argue with this, it's all perfectly true. Case finding, care and isolation, cluster investigation, adequate testing with rapid results, contact tracing, supported quarantining, all the countries that do that are doing much better. Can't argue with that. It is so patently true. But I'm not sure we need the director of the World Health Organization to tell us that, although you could argue it's good to be confirmed, but the bloke down the pub would probably tell you that. At no cost. Those countries that are letting the virus run unchecked are playing with fire, we agree with that, and that can cause further needless death and suffering. A number of people experiencing long-term effects of the virus. Now this is true, and we have looked at this. A proportion of people who are still sick after 2 weeks, 4 weeks, even a couple of months. We don't have data yet, of course, for people that are ill for longer periods of time because the time hasn't simply elapsed. Mental health pressures are there, of course, difficulties for staff and patients alike. So Dr. Tedros says, act fast, act now, act decisively. What is there to disagree with? My mind went back to the way that Dr. Tedros gave advice back in February, March, carrying on flying out of China. Did he act fast then? Did he act decisively then? In English we have a saying, it's a bit rich. It's a bit rich. It kind of implies when there's an irony. So Dr. Tedros is giving us this advice to act fast, act now, act decisively, which of course we agree with 100%. It's just a pity he didn't do that earlier and abort the entire pandemic. But there you go, we are where we are at. Health being seen as an investment rather than a cost, which of course we agree with, and a new and collective way forward is needed, which of course we agree with. So, you know, mothers are great, so is apple pie, it tastes nice. There you go. Anyway, that's from there. So main thing today is that the interventions that we're taking in England, and Scotland have just announced more stringent measures as well, they are starting to work, and we've seen the decline in many cases in Europe. But this has not been done easily, and it's required a lot of restrictive measures. We need to really focus on our individual behaviour. We need to improve ventilation. Let me just show you out my window. This is the middle of the day, and it's virtually dark out there. You know, this is autumn in the northern hemisphere. So today's quiz: if I went outside today, how much vitamin D would I make in that grey, overcast north of England? Answers in the comments if you would like. I'll give you the bottom line now. I'm not sure if the answer is 0, but it's not far above it. Vitamin D levels will be going down all over. Now, I was at Aldi. You won't know Aldi if you're in the States. I was at Aldi the other day, and I saw that Aldi is starting to sell vitamin D at quite a low price, but of course they'd sold out, so I couldn't couldn't bring you any to see. Virtually every time I go to the supermarket now, vitamin D is sold out, which of course is very encouraging, if somewhat frustrating for my personal stocks, but very encouraging that the vitamin D message really does seem to be getting through now. And we know that vitamin D is a vital immunomodulator. So don't forget all these basic things: hands, face, space, ventilate, vitamin D. Get any advice you can from your doctor and healthcare professionals locally. The vaccines are coming to the rescue. I'm just so disappointed that the Oxford vaccine is not reporting its numbers till, it sounds like, well into December. But that's people just haven't caught the infection in the control group and the placebo group in sufficient numbers to give the statistics that are required. Yep, so there we are for today. Thank you for tuning in, and thank you for watching as always.